everyone, and welcome back to another insightful episode of MedSynapse podcast series, where we decode clinical excellence one conversation at a time. I'm your host, Hetwisha, and in today's episode, we are diving into a vital topic for thoracic oncology teams: interventional pulmonology in lung cancer staging and treatment planning. And joining me for this conversation today is Dr. Rowhit Yanamadala, a consultant pulmonologist with a focused expertise in interventional pulmonology, including advanced procedures like EBIS-TBNA, thoracoscopy, and airway intervention. With certifications like EDM and a DNB in respiratory medicine, he combines global exposure with grounded clinical experience to offer precision care for complex lung diseases. So, Dr. Rohit, it is such a pleasure to have you with me for this conversation and welcome to the show.
Thank you for having me.
So, Doctor, to begin with this conversation, so interventional pulmonology has truly evolved from being an urgent tool to playing a central role in lung cancer management. So, could you briefly outline the evolution of interventional pulmonology and its emerging role in the multidisciplinary management of lung cancer?
Very good question. First of all, uh, when we take around 5 years back, the main role of interventional pulmonology is only bronchoscopy or a thoracoscopy. When we deal with simple biopsies or doing some bronchial lavage or bronchial wash techniques. But now we are at a stage that we are sampling very small nodules, including subsymptomatic nodules, and they are rapidly progressing, and many clinical trials are underway for radiofrequency ablation of the tumors. And the EBUS has evolved in many centers. Initially, I think all over India there are a very few handful of centers, but now there are many centers doing endobronchial ultrasound techniques and sampling mediastinum and various lymph nodes. And other advanced techniques have also evolved a lot, like stenting and all. Initially in India, there are around only 5 centers or a handful of centers which are doing, but now there are quite a few number of centers who are doing advanced procedures.
I think that's such a fantastic overview that you've given. So now, Doctor, moving to the next question. While staging often takes the spotlight, there's increasing recognition of therapeutic interventions in interventional pulmonology. So, with the beyond diagnosis and staging, actually, what are the current indications for therapeutic interventional pulmonology in lung cancers, like airway stenting, debulking, or even tumor ablation is gaining traction these days?
Yeah, coming to the therapeutic interventions in interventional pulmonology, as you said correctly, the main approach initially was for the diagnostic approach and staging only. So whenever we see a pulmonary nodule or a lung malignancy, we just used to do a biopsy and just leave it there. And regarding the staging, we used to do an endobronchial ultrasound and do a systematic staging of all the lymph nodes involved. But now coming to the therapeutic interventions, so if you start from a benign pathology like a tracheal stenosis, so when I was with Yashoda and Dr. Harikishan sir team, we used to see many tracheal stenosis case, either because of prolonged intubation or tuberculosis or various other causes. In such cases, dilatation and airway stenting plays a major role and a very life-saving in many of the patients. Especially, we have seen a few patients who are on tracheostomy for a long time, and once we did tracheal dilatation, like serial balloon dilatations, and place stent, we are able to remove the tracheostomy on table, and the patient is able to talk the next day. And other techniques, coming to malignancy part, so in cases where there are esophageal malignancies or a huge mediastinal tumors, we need to place a metallic stent so that the patient is relieved of the symptoms. So once there is a huge compression on the trachea because of the various malignancies, either esophageal or thymoma or big malignancies, there is a lot of shortness of breath of the patient. So to relieve the symptoms, it's a very palliative care, and many patients receive that, especially in esophageal malignancies. And other central airway tumors, now we are doing debulking of many central airway tumors Especially in central airway tumors, we do procedures like debulking, either using a rigid bronchoscopy, just by doing a rigid pouring, or through a snare, or do a cryo debulking. And other techniques like there are recent advances and studies going on for radiofrequency ablation of a pulmonary nodules, but still they're in a starting stage. Maybe in the next few years, we'll be getting even the therapeutic lung malignancy inside the interventional pulmonology branch.
Yes, I think it's so fantastic, fascinating to see how how these interventions can actually offer rapid relief also. So, doctor, can you walk us through a recent case where interventional pulmonology significantly altered treatment plan or prognosis for lung cancer patient?
Okay, so I don't know. I mean, as such, I won't say it altered the treatment, but as you see, after the COVID, there is an increasing awareness of CT screening, and the availability of CT chest has increased a lot. So we see many patients who have incidental findings of a lung nodule. So small lung nodules who are incidentally diagnosed, either doing a CT chest or some other consultant cardiologist who is doing a coronary scan and incidentally picks up a nodule. These kind of patients will present to us, and when we do with the latest technology like CBCT and a navigational bronchoscopy, if we do a biopsy, and many centers are nowadays using rapid onset evaluation, so we immediately get the diagnosis. So once we get the diagnosis of a lung nodule that it is a malignancy, we immediately do a staging, mediastinal staging on table, and the patient is planned for a surgery within 2 to 3 days. So what I mean to specifically say is it has brought down the time gap between the diagnosis and treatment a lot. So within a week, the patient can be back home with a surgery done.
Yeah, I think that's a powerful example, and I think how the outcome actually changed the quality of life for the patients. It is really interesting to know. So, doctor, now let's just talk about treatment strategies and treatment planning. Like tumor boards are increasingly uh, collaborative now. So, how crucial is the role of interventional pulmonology in modern tumor boards, especially when distinguishing early stage versus late stage disease strategies?
Yeah, you made a very good point regarding the tumor boards. Increasingly, like many of the physicians and consultants are recognizing a multidisciplinary team is necessary, and many consultants are being involved for a treatment planning. So particularly in lung cancer, if we see a small nodules or an early stage lung cancer, then pulmonologist or interventional pulmonologist role becomes all the more important. So if you are seeing small nodule of less than 3 centimeter, then there are indications to do an EBUS staging, and then discuss in the tumor board like how to proceed. So if it's an young patient without any comorbidities, the obvious approach will be to do a surgery so that the patient will get a good tumor resection margin and patient is cured at the end of the day. But if the patient is having many comorbidities, or if the patient is an elderly patient with many comorbidities, I think then tumor board plays a crucial role to decide what kind of treatment we are going to do, especially if you want to do a radiotherapy or a chemotherapy. So in radiotherapy, there are centers which are doing brachytherapy, like placing a catheter, especially in the tumor site, and in giving a radiation dose. So even in treatment like brachytherapy, interventional pulmonologist gets involved these days. I want to add one more point. So nowadays, few centers started doing something called fiduciary dye placement. So before a surgery, like a thoracic surgeon takes up a patient for a surgery, an interventional pulmonologist biopsies the case and places a fiduciary dye. So once a fiduciary dye is placed, the resection margin is clearly known, and there is no need to do a lobar resection or a complete, we don't need to remove a huge part of the lung, we can remove a small part of the lung. So few centers in India started doing this, and I think that will be the future also.
Yes, I think distinguishing these procedural things is really important for interventional pulmonologist also. And it actually influences the surgical outcomes of the patient. So now, doctor, finally, given the expanding scope of interventional pulmonology, training becomes very vital. So do you see a need to expand IP training programs in response to increasingly procedural complexity and demand? And what skills should the next generation of pulmonologists actually prioritize in their training?
Yeah, okay. Coming to your question, definitely there is a need for more interventional pulmonology training programs in India. There are centers that are offering a training programs, but as you said, there are more and more advanced procedures being coming up, and there is more need for training. Especially, I would like to comment on one advanced procedures. As you said, initially there are only a diagnostic procedures in interventional pulmonology, like doing a biopsy. And during my residency program in respiratory medicine, there used to be only a fluoroscopy guided biopsies or something like that. But nowadays there are more advanced techniques like cone beam guided biopsy, navigational bronchoscopy, and more smaller scopes are available. And we are able to do a biopsy of small nodules, like less than 1 centimeter nodules. And many centers are nowadays started doing these kind of procedures. And the future is in robotic bronchoscopy and radiofrequency ablation. And in very near time, maybe next year or within 2 years, the robotic bronchoscopy also might come to India. So keeping in mind all these advanced procedures that are coming up, there is definitely more need for IP training programs to come up in India and very structured programs to come up in Indian scenario.
Yes, doctor, I think I could not agree more. And how rapidly it has evolved is also very interesting to know. Like the procedures that were not there a few years ago, but they are now there, and the future actually looks very promising, doctor. So, doctor, as we wrap up today's session, thank you so much for shedding light on the evolving world of interventional pulmonology in lung cancer. And I think I have also gained so many insights from you in the world of interventional pulmonology today. So, thank you so much for sharing that with us today.
Thank you. It's a pleasure talking to you.
Same here, doctor. And to all our listeners, thank you for tuning into this episode. And remember, if you're a healthcare professional who's eager to delve deeper into medical topics or have questions, do not hesitate to join us on the MedSynapse platform. MedSynapse platform is not just a resource, it's a dynamic space where you can connect with your medical peers, participate in meaningful discussions, and contribute to the ongoing evolution of healthcare. So until next time, stay informed and stay inspired.